More than 1 in every 4 children in Georgia has an emotional, behavioral, or developmental condition, and half of all lifetime mental health conditions begin by age 14. Yet over 3 out of every 5 children with a diagnosed mental health condition are not receiving mental health services. Fortunately, there's a Medicaid benefit designed to close that gap. It's called Early and Periodic Screening, Diagnosis, and Treatment, or EPSDT.
EPSDT is a federally required Medicaid benefit that ensures the more than 1.3 million children and teens enrolled in Medicaid in Georgia can receive regular health checkups, screenings for physical and mental health concerns, and treatment if a problem is found.
The EPSDT benefit requires state Medicaid programs to cover regular screenings, mental health assessments, and any medically necessary treatment identified during those screenings, even if the service isn't typically covered under the state's Medicaid plan. For youth mental health, EPSDT is especially important because it helps identify behavioral health needs early and guarantees access to services like therapy, counseling, and specialized treatment. Behind these policies are real families trying to get their children the support they need. And when they are able to access the right services at the right time, it can change the course of a child's life.
When a child struggles with mental health, the entire family really does feel it. And so access to early care can change the trajectory for both the child and the caregivers providing the support. So we know that usually mental health needs are layered on top of medical or developmental disabilities. And so it's important to treat the entire child when you're thinking about providing care.
At Parent to Parent of Georgia, Latoya and Satara work with thousands of families each year who are trying to navigate complex health systems and find the right services for their children. Satara shared one example of how EPSDT helped a family access the support their child needed during a crisis.
Because EPSDT has to meet all the needs of the child, they were able to get their son into a crisis stabilization unit that Georgia has, I think 3 or 4 of them. And then they also worked on some intensive home-based supports for the family so that when he transitioned back into the home, he had supports. And one of the programs that he was involved in was a wraparound program where they had a psychologist, a social worker, a nurse, all coming touch points at different points in time to see how things are going with tools of behavior support, staff, all those things together. And then this child was then able to go back to school.
When families can access the right care at the right time, children can stabilize, return to school, and move forward.
EPSDT is a really, really important federal law that exists because, for one, it does not limit the number of sessions or therapy sessions or treatments or programs that a child can access. And I think that is really important. While, your private health insurance might cover mental health, it might limit how many sessions your child might be able to attend. But under EPSDT, you go with what the child needs. And the other thing about EPSDT, it's woven into the regular health checkups, right? So that makes it really critical because sometimes a parent might know something is going on with my child. I don't know what it is, but this gives them that opportunity early enough to catch it and telling their doctor, telling their healthcare providers hey, something is off, because most parents have that gut feeling, they have it, they have those instincts, but they just don't know what it is.
My child was not developing typically, and I brought that to the attention of my medical provider at his checkup. And we discussed options and came up with a plan. And I really believe that early intervention really changed the trajectory of my child's life.
EPSDT provides this access to families that children can get the supports they need. It improves their school life, it improves their home life. And then if families are not consumed in that diagnosis, it gives them an opportunity to think a little more, to really dream for the future that they would have.
In Georgia, 42% of children rely on Medicaid for their health coverage. And EPSDT is the federal guarantee that helps ensure they receive the mental health screenings and treatment they need. When we invest in Medicaid, we invest in Georgia's kids. When Georgia's kids have access to the mental health care they need, they are more likely to succeed in school and build stronger futures, benefiting the entire state. To learn more about youth mental health and Medicaid in Georgia, explore these resources.